And good evening. Welcome back to blackdoctor.org, where wellness and culture connect. I am Dr. Cordai Decoto, board certified podiatrist for neighborhood health, providing care for all regardless of status or insurance. I am also the co founder of Sisters in Podiatry, a Facebook focus group for Black women in podiatry within the United States and the Caribbean, and your host of the premier show, Stepping Forward with Dr. D, your gateway to all things podiatry. So this show I'm super excited about. And I want you guys, we rep where you come from. So if you're from Miami, if you're from West Coast, my Northeast folks, post where you're from and say hello, and we'll say hello back. This show gives me great pleasure because we're talking about the state of podiatry residencies. Podiatrists do residencies like any other doctor, and we're very proud of it, and a robust residency. So who better to bring on than one of the gurus of our profession, Dr. Lowell Weil. Dr. Weil is the executive chairman of Balance Health, the only national podiatry practice that is majority owned and operated by podiatrists. Prior to that, he was the CEO of Wild Foot and Ankle for over a decade, and I had the pleasure of working with him. He started the first fellowship in podiatric residency in 1998 and served as the director until 2018. He was the editor of Foot and Ankle Specialist, the only combined orthopedic and podiatric peer-reviewed journal in the world. He was the founder of the Foot and Ankle Business Innovations, FABI, which many podiatrists know, which for a decade helped podiatrists across the United States improve their business. I could go on and on. He is a founding partner and board member for GLW Medical Innovations. He has multiple patents on surgical implants and invented surgeries that have helped patients around the world. Many of us know the wild osteotomy and so many other things that we use for different companies. He has lectured in 5 continents and 13 countries and 32 states. And I don't know, you might get some fight back on this one, but he has previously been the team podiatrist for the Chicago White Sox, if you're a White Sox fan, and the Chicago Bulls. And we welcome Dr. Lowell Weil Jr.
Thank you, Corda. It's super pleasure to be here today. I was thinking back of when you and I we started having a relationship, and it was almost 10 years ago when you and I first were introduced and we started working together. And so it's super fun for me to think back on the times when we first started hanging out and working together. So I'm excited to be here today and really proud of what you've done with this organization.
Thank you. I know we had the pleasure of people probably wonder, how do these two know each other? And they said, when we started working together, and then we really just enjoyed each other and we would chat back and forth. And here we are today. So tell me, when people think podiatry, your family's name, Weil, is known. Orthopedics, podiatry, what have you. Tell us, how did your family get into podiatry? I don't think I even know that story. Starting over, I guess,
Yeah.
with your father and how you got into the profession after.
Yeah, well, it certainly goes back to my father. And my father, crazy enough, he went to 1 year of college back in the 1960s. And then there was a dual program to go to podiatry school and get your undergraduate and your podiatry degree
Mhm.
concurrently. And he started podiatry school at 18 years old, if you can believe that. And he graduated from podiatry school at 21, 22 years old, whatever those years ended up being. And he ended up then doing, at that time, the longest residency in podiatric surgery. He went to Detroit and did his residency. And then he opened his practice in 1965. And he was a really young kid at the time. And he tells a story that when he opened his first day of practice, somebody walked in and he was working the front desk. He was the front desk, he was the medical assistant, and he was the doctor, because that's what he could afford. And the first person that walked in said, "Well, can I see your father?" And he was the doctor. And he looked so young. They actually thought he was a kid working for his father as an assistant. So anyway, that was back in 1965. And then my dad did some really neat things. He started at the time, one of the best residencies in the country. He's super involved with medical innovation. He invented the first ever total joint replacement of the first toe joint and all total joint replacements of the first toe joint are now based off of that predicate before there was an FDA. He got really involved with research and publication and speaking around the world.
Mhm.
He became the team podiatrist for the Chicago Bears, the White Sox. He was the team podiatrist for the United States Olympic gymnastics team in 1980.
Wow.
And that was a year that they actually boycotted because of Soviet invasion of Afghanistan. But nonetheless, he was recognized in these different ways. And as a kid growing up and seeing him involved with all of these athletes and doing all these cool things, every time we'd go out to dinner, someone would run up to him and say, "Dr. Weil, you did my surgery. Thank you so much." Like that's really influential as a kid. And I was really into sports, but as a very talentless athlete, my best opportunity to get involved with sports was to do it through medicine. And so I saw my dad's route, and I took that same route. Didn't look back, and couldn't be more thankful. I'm so happy where I am. It's an amazing life that we're able to lead, helping people.
So tell us, why do podiatrists do a residency? And then talk to us a little bit succinctly about what a fellowship is, because you have one of the most coveted fellowships. I think everybody knows you about your fellowship, and just give us a little highlight on that.
Yeah, I think there's maybe a misconception in the populace. Podiatrists go to medical school just like any other physician of any specialty. We do specialize more in the lower extremity and the biomechanics of the lower extremity and the surgery of the lower extremity. But then we go on to surgery, and our residencies. And our residencies consist of both getting the full education as any medical resident would get, but then we really focus and specialize in the orthopedic surgeries and then really into the foot and ankle. And so nobody spends as much time training on foot and ankle pathology and care and surgery than we do as American podiatrists. And so we spend 3 to 4 years in residency making sure that our skills are honed. And I know you've got some people who are going to join you later in the show who are really responsible for the great residency training that you are a part of, and others as well. And then at the end of residency, many people want more. They want to go take their training to a higher level. And if we use orthopedics as a way to look at it, general orthopedics, when you finish an orthopedic residency, most people go into specialized fellowships, whether it be sports medicine, joint replacement, trauma, and so forth. So when I had the vision of starting a fellowship more than 20 years ago, 25 years ago now, 26 years ago, we decided we wanted to really mirror what orthopedics were doing. We wanted to take the podiatrist who is highly motivated to really get unique skills and be the best of the best in their community. And so what a fellowship is it's taking the great skills that one learns in a residency and hones them so that they become the best practitioner in the clinic, patient being able to communicate well, and then really being able to take the surgical plan to the finish line and create the best outcomes possible. And so that's what we try to do within our fellowship, and so many great fellowships have followed since then.
Wonderful. Well, that being said, I have some great guests with relationship with each one of them that are either residency directors, assistant residency directors, and I'm just so grateful that they're on today to give us, their background and how residency works. For those who are interested in podiatrists, knowing that your doctor should be a board certified podiatrist, knowing how their training is. So I'm going to introduce one of my former residency director, and I can call a friend now, Dr. Emilio Goez. Welcome, Dr. Goez.
Hello.
How are you? Great. So I'm going to read your bio. Dr. Goez is fantastic. He's been in private practice in Freeport, New York. He is the chief division for podiatry at St. Barnabas in the Bronx. He is a program director for the residency. He is a member of the board of directors for the New York State Podiatric Medical Association. He is amazing, as you're hearing. He received his degree from where? The New York College of Podiatric Medicine, which I did as well. So we have that in common. He is a fellow of the Academy of Foot and Ankle Surgeons and the Wound Care Association. And I could go on and on and on, but I'm not going to. I'm going to welcome Dr. Emilio Goez.
Thank you so much. Thank you for having me.
Thank you. So I did my residency years ago. They don't need to do my business. I'm still trying to keep it together. And It was amazing in the Bronx. I felt like one of the things that I'm big about, and Lowell knows this, is diversity. I want to see everybody. And I know when I did my residency, I felt like I was in a microcosm of We Are the World. It was
Correct.
amazing because we had so many different other residency programs that were with us in addition to podiatry. So you're involved in one of the oldest podiatry programs, especially in the Northeast. Tell us what you look for. What do you let me take that back before you look for what do you say that you give back as a residency director? What is it that you're trying to pour into your residents?
Well, this year, believe it or not, is the 30th year I'm a program director, and I was very young when I started this. And I would say that I would have to answer that question differently now than I would have 30 years ago. Um, it is definitely more challenging now because the education, the advancements in surgery, and Dr. Weil, I'm sure, would agree, the field of foot surgery, foot and ankle surgery, has made huge progress in the last 30, 40 years. So not only have we had to keep up with it, but the education has had to keep up with it. So
Mhm,
I would say that nowadays, the what I do now is try to harness the education that the residents got during their medical school years and try to focus them on what it is that they like, what they do best. And just like Dr. Weil expressed before,
mhm,
some people become podiatric surgeons, reconstructive surgeons, wound care experts, some pediatric, podopediatric, care of the feet and children. So I would say nowadays it is actually a little bit more difficult to be a program director due to the different requirements.
mhm,
By the same token, I've gained a lot more experience, and so has the profession as a whole. And so there's a lot of support systems within it. And every day, every year, at graduation, which is coming up next week, I always say these guys are the best trained podiatrists that we've had, and the reality is that it is true.
mhm,
We've been able to keep up with it, and currently we're just trying to expand to increase the number of spots that are available in our hospital because of that diversity, as you experienced. We are inundated with cases, with complexity, and with just different kind of disease.
I agree. I remember when I became an attending, I had a woman that was sickle cell and diabetic. And
Yeah.
usually in the lower extremity, we use tourniquets unless there's bad circulation. One of the things that you have to be careful about in a sickle cell patient. And somebody said, you would never find this except in the Bronx. I was like, mm-hmm. And it was a fantastic case because even in residency, we'd see things like, where is this coming from? Simply because of the diversity that we had in the Bronx. And I appreciate that. I see
And that
people checking in from Central Jersey. Hello. From the
eh,
DMV area. Hello, hello, and good evening. I
that
am going to,
case
oh,
that
I'm so
case is
sorry.
also interesting in that it illustrates the breadth of what this profession encompasses. I mean,
Absolutely.
diabetic with you know an issue where they can end up with terrible pain. You would have to manage diabetes, glucose, blood levels,
Absolutely.
anticoagulate, pain medication. So those are the cases where you say, you know what, the podiatrist in fact is practicing medicine.
Absolutely.
Yeah.
Thank you. So I'd like to introduce another colleague, Dr. Amir Ahmed. And he is from the competitor. I always laugh. St. Barnabas Cooperman, excuse me, St. Barnabas Medical Center in Livingston, New Jersey. We welcome Dr. Amir Ahmed. Is he on? I think we had a snafu maybe with his recording, so I'll move on to Dr. Coetzee until we got Dr. Amir back. Dr. Where is he? Dr. Coetzee, are you there? Okay. I want to introduce Dr. Coetzee. Dr. Coetzee? I don't know if we're having a snafu or not. Um,
No, I'm ready.
there
No,
we
that, yes.
go. Fantastic. So Dr. Coates, I've had the pleasure of meeting recently as I have privileges at Trinitas Hospital in Elizabeth, New Jersey. He is the residency director overseeing the education of 6 residents. He also graduated from where? The New York College of Podiatric Medicine in 2014 and did his 3-year residency at Trinitas. He is in private practice, specializing in limb salvage and trauma, and is board certified by the American College of Foot and Ankle Surgery. And he is happily married with 3 young children. God bless you, 5, 3, and 1. So having him here is a delight. And he enjoys skiing. So with that being said, how do you manage time with the residents? Because being the director, again, as I said to Emilio, pouring into your residents, teaching them the things that they want to know. I mean, and you also have the variety of podiatric surgeons that come in to do cases. How do you say that you time manage that and making sure that, as Dr. Goes said, you may have a resident who likes podopediatrics, dealing with kids. You might have somebody who likes trauma. You may like somebody who has cosmesis and plastics. How do you deal with that?
So I graduated residency from Trinitas in 2017, and I recently became director in 2020. So I had my challenges becoming director, as I've only been in practice and experience with post-residency life for only 3 years. So I was a relatively very young director in the field, and I had my challenges, especially I was still gaining my independent experiences teaching and doing cases. Although my case volume was very high immediately after residency, I was doing many cases a year, well over 100 my first year. I became board certified very quickly in American College of Foot and Ankle Surgery in 2020. But also I grew into it because my first child was born in 2019. So she was a newborn. I have a lot of support from my wife. She's very helpful. She's great. So as
Yay to Mrs. Coates.
happily married, right? But as my personal life became busier and busier, so did my residency. So they kind of grew together one-on-one. So I really managed my time very well. Like I said, can't do it without the support of the wife. You know, I do get some rebuttal here and there when we do like evening cadaver labs, evening training. And she's always like, you know, why are you doing more? There's always more to do. And there's always more to learn. There's always more to teach. And, you know, of course, I'm still training specific skills of mine. And there's always something to learn. You never stop learning. And I'm only 7 years out. So there's still a lot more to do and a lot more to gain and a lot more to teach. And, you know, the growing minds, you know, like and the other Dr. Weil and Dr. Goes said, it's a very well-involved field. You know, we work very closely with vascular, we work very closely with general surgery, internal medicine, and my program, we really train our residents to work closely and be comfortable with them, and they do great with them. We have a very intertwined discipline, and we work very closely together because our patients are very sick, whether they have renal failure, or they have very poorly controlled electrolytes, or like you said before, you're talking about sickle cell. I have a patient who has just today came in with an osteochondroma and has sickle cell disease. So
when you're talking, hold on, those are big words. So we're going to break that back down. So in layman's terms, because somebody just went, what is a who, an electrolyte, and a what? So basically, I'm going to make you repeat that in layman's terms for the people who are watching who are non-doctors.
So people who have advanced kidney disease, whether it be from diabetes or hypertension, you know, you could take them for non-elective surgery, whether it's an amputation or a wound debridement that needs to be cleaned up because it's become a non-viable wound. Because of their poor kidney function, their sodium could be too low, their potassium could be too high, and with anesthesia, it could be very dangerous or even fatal. So these things have to be closely watched, closely managed. And sometimes, you know, internal medicine standards are different from anesthesia standards, and they don't agree, and cases can get canceled last minute because of poor management or changes of electrolytes or a disagreement with dialysis times. And there's a lot of aspects that have to be watched. And plus, when you're dealing with people who are smokers, diabetics, they also have poor circulation, has to also work with vascular and make sure they're optimized. You don't want to do a surgery where they don't heal, or because you're doing a disservice to the patient. And then on top of that, a lot of these patients also have cardiac disease. So you have to work with the cardiologist to make sure the cardiac clear, optimized. You don't want to take a patient who's very high risk or not stable. Then they have anticoagulants, whether it's Coumadin, Xarelto, a blood thinner, which helps prevent clotting in the blood. And if you're doing an open amputation, it could excessively bleed. And if it's infected, you can't really use a tourniquet.
Problem. Exactly.
Right? So these are all things that they manage very well, and they have to learn how to manage and deal with other physicians. And we recently just had a site visit from the council, and one of the things that we really impressed them on from our program was the support we have from all the other disciplines and how well they support us. And they don't always see that all the programs. They really enjoyed that a lot.
Absolutely.
All the other division chiefs came out to support me during the site visit, and they're very impressed by that.
Great. So I'm now, Dr. Mears back from the other St. Barnabas. One of my favorite places. Oh, no. It's fine. So Cooperman St. Barnabas Hospital, Medical Center. Let me make sure I'm saying that clear. Cooperman St. Barnabas Medical Center in Livingston, New Jersey. And I'm going to read your wonderful bio. So Dr. Amir Ahmed is born and raised in northern New Jersey, woohoo, and went to the New Jersey Institute of Technology, where he earned his bachelor and master's degrees in biomedical engineering, while he was a Division I track and field athlete. Good to know. He also went to the New York College of Podiatric Medicine, did his residency in St. Mary's General Hospital in Passaic, and did his fellowship at the Pediatric Foot and Ankle Fellowship in Cedar Knolls. His fellowship focused on congenital foot and ankle deformities, Elizarov techniques, corrections of pediatric trauma and sport injuries. And he is practicing at the Ankle and Foot Doctors of New Jersey for over 3 years with Dr. Jay Voodoo, who couldn't be here today. He is the director of the hospital. And we welcome you, Dr. Amir Ahmed.
Thank you so much for having me. Dr. Buddha would definitely want to be here. He apologized. So any questions I can definitely answer for him. I'm very well coordinated with the residents and, very well attached to the residency program. I am their academic director as well. So I spend a lot of time with them as far as, the residents and their education in general. I do love teaching overall. I think passing along any knowledge, especially nowadays when knowledge is so advanced, there's always movement in the field of medicine, and teaching the younger generation before they come out the right ways, or the what's considered proper techniques and such to do certain things, especially in surgeries. I think is very important. So I spend a lot of time with the residents whenever I get the chance to even teach them. But yeah, overall, thank you for having me on the program. If there's any other questions, I'm not sure if you have
any. You'll definitely get them. Thank you for being here for that. And of course, I saved her for last because she's a good friend of mine. She's also a sorority sister of mine of the Alpha Kappa Alpha sorority, for all our sorors who are watching. Dr. Rishiman Coart, come on board. Do we have her on? I don't see her picture yet. As soon as she comes in, I'll introduce her because we're missing her. But I want to make sure that she's here. And I'll get back to her once we do that. So I'm going to ask some questions while we wait for Dr. Coart to come on. So residency. Besides the residents learning techniques, besides the residents we do papers, I published when I was a resident. What would you say? There's the Dr. Coart. Okay, I'm going to hold that question then and come back to you. Dr. Coart, welcome. Dr. Coart was the Associate Director of Podiatry at Bellevue Hospital for 15 years of clinical and surgical experience. Their residents rotated throughout the boroughs of New York City. She has published articles collaborating with many medical and surgical disciplines such as anesthesia, medicine, and the orthopedics department. She's a graduate of Fisk University and HBCU. And she moved to Boston to do her Harvard post-baccalaureate program, where she discovered the field of podiatry. She also went to the New York College of Podiatric Medicine and she was trained through at Coney Island, Woodhull, and Gouverneur hospitals during her time. She also did her fellowship at Jacobi Hospital and recently completed her MBA. She is a member of the American Diabetic Association and again at the Alpha Kappa Alpha Sorority Incorporated. Hello, Sor. So we welcome you to the show. So Rishi, being the queen, you're welcome. Being the queen for today, because you're amongst all the kings, the queen.
Yes.
Tell me, how is it being a woman in podiatry? Because podiatry, I mean, medicine, I have tons of friends, men, women, what have you, but I think it's a little special being a woman and trying to navigate sometimes through medicine. Tell us what your experience is like, and for your residents if that matter.
Yeah, no, definitely. I started residency, right after I started residency, I did my residency through the city hospitals. So again, I also had that broad scope of seeing a whole lot of different pathologies, a whole lot of different people, coming through Coney Island, going up to the Bronx at Jacobi, Gouverneur Hospital, and again at Bellevue. I really got to see a wide range of pathology, which I think really helped, in the residency program. And as Dr. Wild stated, then being able to move on to a fellowship, in Jacobi Hospital, which is still part of it, getting to see so much and really getting to really home in on your skills. I had a lot of experience, but really getting to just home in on just surgical patients, what they need, before, after, and really getting to understand that whole process, because that is a real whole process, and making sure that the patient is involved in that process was, a huge thing. As soon as I came out of fellowship, I went straight to Bellevue Hospital, and I was also affiliated with NYU. So I did a lot too with their hyperbaric oxygen, with their clinic down there. So being a woman, though, was different. I got married like 2 weeks before I started residency. So we had to wait like a whole year to even think about a honeymoon or anything, because I did like 2 weeks graduate, 2 weeks got married, and 2 weeks started residency. So it was really quite a lot. And then once I started Bellevue, I then had my first child a year after, and I have 2 children. So, definitely it takes a little different toll. I always felt like, though, I didn't want it to be like, women, not carrying your weight, you know what I mean? And I know for me, pregnancy, they were like, oh my goodness, are you okay, Dr. Court? Doing surgeries and stuff, you got this big belly and stuff, but, I'm feeling fine, totally fine. I'm up on surgery, and I stayed on to that Friday, and I delivered on the Monday, and then I took my 6 weeks, but still I felt like it's still, I still love podiatry, as a great field, just being, incorporated into including so much in terms of medicine, because we also had an in-service patient, we had an inpatient service. So with that also being incorporated, we had a lot of surgery patients that we admitted, from the ED, and, taking them to surgery, doing a lot of, emergency cases, such as, I'll say like a technical term, gas infections, but just infections that needed to be taken care of at a, rapid amount of time. And, I was called away a lot because I was on call. And, sometimes it's a little different toll. I know Dr. I want to pronounce his name correctly, Cosillas, like mentioning about the support, that's really important too. And I think it helps to have that support system. And my husband was always very supportive. And, we have 2 children now, they're both teenagers. So it's a whole nother level now of having 16 and 14. So
good luck.
That's a whole
well, we thank Greg Coart for supporting you. He's my brother. And we thank Mrs. Coates. So my questions going forward, when you have these residents, right, that's a lot of personalities to deal with. I know I probably gave, Dr. Goez hell, I'm sure, in residency. Dr. Wild, maybe as well. I don't know. What would you say that, and I'm going to just pick you randomly, what would you say you're looking for in a resident? Because we have something called matching. Every medical person who goes through medical school of any type goes through a match process. where you're trying to pick the residency programs that you think you're best fit with. And these residency directors or fellowship directors are trying to pick who they think they match best with. And so that's one of the things I remember in residency. You and Rishi, you remember this. I remember trying to pick number one, but you think number one is higher than number two, and it's like a game almost, Game of Thrones, So I would say I'm going to throw that to. I guess I'm going to throw it to Dr. Goes first because he's my former director. What are you looking for in a resident? And then I'd like to throw that question to Dr. Coetzee second.
So very early on, I learned that the most important thing for me and actually for all the people at the hospital, we've all been there for a very long time. Um, it's to ensure that the resident wants to be at the institution.
Mhm.
In other words, they have to get along with fellow residents, with attending doctors, and they have to see that institution as a place where they can get their education. We are blessed at St. Barnabas. It's the entire institution is an educational center. We have nearly 400 residents in every specialty, and lucky for us as podiatrists, not in orthopedics. So the residents have always been able to work the entire time. You worked your entire time as a resident, really as an orthopedic resident, which is why you come out so well versed in all the areas of medicine and surgery. But that is the most important thing because there are people that strictly want to do preventive foot care and a big residency where you're going to be doing hips, elbows, feet, knees may not be for everybody. So what I concentrate on with every student, and I sit down with every student that comes to, and I say to them, the most important job you have to do this month, these 2 months, depending on how much time they spend, is you need to figure out if you want to be here. This place will educate you not only as a surgeon, not only as a podiatrist, but as a really good physician, but you have to want to do the work. And so that's what I look for. Do you want to be here?
I remember having a leg on my shoulder when I was doing an ortho case, and this guy had this horrible infection in his leg that smelled like hell. And I remember, and I'm 5'3.5", I round to 5'4". And I remember the ortho attendings were always a foot taller than me. I remember Dr. Reamer particularly yelled at me one day, "Ah!" And I was like, "Are you done?" And I said, "I can't see." He was like, "How tall are you?" I said, 5'3.5", but I round to 5'4". And he's 6'4". And I remember the joke was, Dr. Dakota needs 2 step stools. Always put that on the card. And so, we formed a relationship after that when I was doing some of these ortho cases. Dr. Coetzee, you have your residence. I was in there today doing a great case, the first MPJ fusion, and I enjoyed it quite a bit working with the residents. So I will say, what do you look for in residents? What is your goal when you're choosing good residents for your program?
So it's not as much of a challenge for me, only because I have a smaller program. I understand when you have a bigger program, there could be a lot more personality disagreements or clashing personalities. But as Dr. Goa said, we want intelligence residents, we want hardworking, and we need people that can work together as a team without causing issues amongst each other and other departments, because that's not very progressive. So it is a challenge, but I do have a smaller program, so it could be a little bit easier to make sure everyone gets along. But those are the 3 key things that we look for. Okay. Nobody wants a lazy resident. Nobody wants someone who's not academically up to par, or, with their current knowledges. And obviously everyone wants to work together very well, because when there's personality clashes, it's going to be a distraction. It can cause issues internally, and the only person who suffers is the patient at the end of the day. So those are the 3 things we look for, and I know my residents, and they get along quite very well.
Absolutely. I'm going to pose this question to Dr. Weil and Dr. Ahmed. So, and Rishi, I'm going to get to you with the great question in a minute, and I want you to chime in this. So let's talk fellowship. So when you do post residency training, now you're at the fellowship level. What does, and usually residency can be, it's changed over the years. We know residency started off as 1 year to 2 years to 3 years. So now, post residency, you're looking at a fellowship for more specialized training. Dr. Weil, you first, because I've had the pleasure of visiting your institution in Des Plaines, Chicago. Tell us what, I mean, because come on, what are you looking for when you're looking for the fellowship to say, I'm taking this doctor to the next level? What is it that you're trying to impart in them and what you want from them as well?
Yeah, when we started fellowship 26 years ago, there wasn't a lot of podiatrists, residency trained people who wanted to go into fellowship. They didn't understand what doing another year was going to provide for them in their career and their ability to care for patients and the things that come from that. But over the years, more and more podiatry students, residents, and so on have seen the value of going into a fellowship. So the quality of candidate pool we have is pretty vast. So we're getting the best residencies in the country sending us their best residents as applicants. And so the academic achievement is there, the residency achievement is there. So that's kind of the baseline. What I'm looking for in a fellow to have somebody come and spend a year with us and really be a part of our family, truly a part of our family from day one, because they, as a fellow, you actually spend more time with your fellow than you do residents and attending, because the residents are running around the hospital. Fellow to attending is side by side in the clinic, in the operating room, and during academic time. So there's far more interpersonal activity going on. So I'm looking for really quality human beings. And I really look for that. There are people who are more academically sound, but I pick somebody who might not have the pedigree academically because they're really good human beings. And I want to help develop real good human beings. I want people who are going to take the time and effort that we pour into their training. Because each person on this in this meeting right now, we pour so much effort into the people we train. We want the people who are training to appreciate it and then take that and do something great with it to help their community, to help the profession, to help patients. And so I'm trying to find and isolate that one person each year who is going to take that legacy forward and really pay it forward. And I think when you start to put it into those terms, the key one or two people really stand out because you can really see that person is really going to do that. And right now, I've got a fellow that's just amazing. She is going to change the world, and I feel very lucky that I'm with her every single day because she's going to make such a big difference in her community and really beyond that.
Fantastic. I remember when I had the pleasure of visiting your location, and I'll just tease you a little bit. He literally asked me, he said, "Do you want to come see me do surgery?" I looked at him like, "Do you realize who you are?" And his wife, lovely Wendy, Dr. Weil as well, is a surgeon. Of course, his father. I'm like, anybody worth their salt is running to that OR to see you do surgery. Count me in. Yes, check mark. So that's one of the things I think also is what we give back because there has to be a relationship between you and the fellow, between you and the resident. Dr. Ahmed, you did a fellowship and you also are getting you I've seen the residents that you've brought out and having them go into fellowship, one in particular that I know of, you did plastics. Tell me, how do you think you train your residents to go into fellowship?
So, as far as having I think I'm going to step back to the initial question you did ask Dr. Goaz, Dr. Kosietz about, what you look for in a resident and how you want them to be to begin with. It starts with that initial attitude. There are two words that always will stick into my mind because my residency director always imparted this, or he mentioned this, and it kind of stuck really well. Is even when you're in residency, you should learn to be humble but aggressive. And I think that really encompasses a lot of the things that the other directors have said about working well with others, right? That's the humble part, that you're not trying to overshadow. You're not trying to, because in a residency program, when you're taking care of the list of inpatients, you got to work together. So that brings together the whole social aspect, the fact that you're able to listen, work with your teammates, work with others. So, I mean, if you're going into fellowship, right, that kind of teaches you. I mean, at least from my standpoint, I would rather impart on the residents that you have to be able to, number one, be humble and teachable to begin with, right? Don't go in. You're not going to a fellowship saying that, hey, I know everything, or you're going into there pretty much saying, listen, I want to learn from you. That's why I'm interested in your program. So the humble part is probably encompasses the whole aspect of working well with others, with listening, taking instructions, and actually learning, right? So if someone says, hey, do something this way, surgically or even just clinically or they're able to be, they're teachable. They're a teachable person. And that's what I'm sure, as any fellowship director, and I'm sure from, my fellowship director as well, he always said that, they have to be someone that's teachable. Otherwise, if you know everything, then why are you here? Right. Exactly. So that's the whole part, number one, about being humble. And then the second part about being aggressive, that for me encompasses the whole aspect about academia and learning, like really aggressively, spending the time to actually learn, because I always put into my head that I only have 3 years of residency, right? When I got into residency, I didn't know if I was going to get into a fellowship. But I said, I have 3 years to learn everything that I possibly can and learn it really well. And I'm going to spend the time, long hours, whatever it is, right? Because that's what we know. That's what residency is. So that's what I tell the residents right now who are looking for fellowship, that if you go into a fellowship looking to learn something that's new, right? So when I chose a fellowship, I chose something that I didn't get during my residency. So when I tell the residents, if you want to go into the fellowship and it's something different that you didn't get in the program, great. But you have to make sure you spend that 1 year, long hours, whatever it is, you have to get as much as possible out of that 1 year. So that's the aggressive part, meaning, and again, that encompasses all the way from out of the operating room all the way into the operating room. So being prepared, learning as much as you can about the cases, because majority of the fellowships, they're only one fellow. So it's all on you, right? It's not like sometimes, in residency, when you have multiple residents, the day before they're kind of choosing, all right, I'm going to go cover this case tomorrow. Versus the fellow, you're covering all the cases.
All the cases, correct.
So it's on you to be very well prepared to go into the case. So you are aggressively learning everything that you need to about the cases, and aggressively when you're in the OR, right? Again, there is a component of being humble where you're listening to your mentor, right? Your director, and then you're also showing that you're confident, or displaying the confidence of performing the procedure, or even let's just say helping doing the procedure. You're ready in the operating room to the point where your director is like, all right, this guy knows what he's doing. I'm going to let him go. So I instilled that in myself. So when I became a fellow, my fellowship director, he let me go. He let me
he let you fly,
skin to skin right away. So basically, everything encompasses that being humble, but being aggressive part. And I instill that in the residents now to have that before they get into fellowship.
Got it. Rishi, Dr. Kowart, my good friend. We have 15 minutes left, which I always like to give everybody a heads up. So we're going to try to keep these answers a little short. We've talked about residency. We've talked about fellowship. Can you just walk us through, like, okay, I'm interested in podiatry, because I think a lot of people are like, this sounds cool. What do I do? I go into podiatry school. I apply for podiatry. What happens now that I'm a podiatry school trying to get into residency and or fellowship? Give it to us in a few words if you can.
Yeah. So, the first thing, again, I think, once you decided, I think I want to try podiatry school. After that, when you're looking into a residency, key things that I think Dr. Go has mentioned on too about finding a residency that you think you can kind of fit in. That would deal with the case with location, trying to find a location that you think might be good for you. Trying to find a fit in terms of program. Programs are different. Some are much smaller programs, which you think you might fit into, which mean one or two residents. Some of them are much larger. I think we had at least about 6 residents rotating at one time too, which can be a bit larger. So again, you have to find something that again you're going to be able to fit into, which is why definitely these the visits are so very important. And your podiatry school should offer the visits where you're doing the externships where you're actually going to shadow with the programs, which is so important. And that's a really key thing. A good thing I think that's coming up is that the students now have more, which is really important. And just key in on that. And once you get that, try to find a program that you can fit. We're going to start the residency now. I believe are set like 3 years now. So, being set, you're doing your 3 years, looking into if you decide to do a fellowship, if that's something for you. If not, you're going to start to look into what are you going to do after. There's so many different, avenues right now. There, of course, is always private practice. There's hospitals. There's clinics. Clinics are becoming huge right now because a lot of the big hospitals are shooting off satellite, offices, which are becoming big now. So again, so there's a lot of things, that really you have to see if you fit and how you're going to feel.
Absolutely. I went from private practice as an associate. I went for a partner. I went to a big podiatry group with a while. I went into a multidisciplinary group in Jersey for 7 years, and now with the federally qualified health center. And we'll see what the future brings because I just like having my toe in everything. So one of the things that came out in the news, and I bring this up, they were talking about, because we are on our blackdoctor.org, they were talking about the less than 6% of doctors, and that's a significant number, are African American. They didn't even talk about surgery. Let's not even talk about specialties. Less than 6%. Usually in the specialties, they're saying it could be less than 2%. So what do you think? I'm going to throw this question to Dr. Weil, only because we've had great conversations like this. What do you think if I know who your fellows are, obviously, some of them, but why do you think that those numbers are like that? And this is not in podiatry. This is across medicine as a whole. Different CNN has talked about it. AMA has talked about it, and sometimes, people look back when people think about it, they're like, those numbers seem, are significant, and they are. So what would you say based on seeing, residents and seeing fellows, what would your opinion be?
Yeah, I mean, it certainly goes back to a problem that exists in education well before podiatry school occurs, and the access to education and the access to the opportunities to move oneself into medicine and things like that. So that's a conversation that I'm not really very well versed to be a part of. But when it comes to podiatry, I just don't see. You say why? I don't know if I know the answer is why, because so many podiatrists are treating the Black community, and the Black community is some of the most hard hit by the problems that we see as podiatrists. So you would like to think that there are these amazingly smart young people who say, my family member has these problems, and I see the care that they're getting, I'm going to follow the path of helping the people of my community. And I don't know if podiatry or medicine as a whole has done a good enough job of marketing itself to those communities to say, look, we want you in. Let's help your community, because the best way to help one's community is to be a part of it. And no matter what ethnicity or race you are, people desire to see somebody like that. Whether they're of Mexican descent, they want to see a Mexican doctor who speaks Spanish. If they're Polish descent, similarly. And Black people are the same. They're going to want to see somebody who speaks to them in a way that they understand and has a similar upbringing. And I think it's just a terrible thing in our country that we're not seeing more of the talented young Black people entering medicine. And podiatry is going to be no different. But when I look at my history of fellowship, and I'll even talk about hiring doctors in our national organization, I get so few Black candidates, qualified or unqualified. I have so few. And we have trained, we have had fellows that are Black, but I'm kind of regularly surprised that I'm not seeing some of the real talent come and say, hey, I want to be a fellow, or I'm going to apply for your job, which makes me now realize when you throw out that statistic, it's not that they're not interested, it's that they're not there. It doesn't really exist as much as it should.
Mhm.
So I don't have an answer for that. I wish it was different, but I think for the people who are listening to this show is the community needs great doctors from the community. And I would encourage you to spread the word to the talented young people in your communities and say, this is a great profession to go into, and you can really make a difference in your community.
Thank you for that. Dr. Goes, I'm going to throw it to you because, like I said before, I thought our residency was a kumbaya residency. I always tease about that. We were so diverse. I'm going to say, and I would like to hear your opinion, I think part of it was location. The Bronx is a melting pot for everybody. You will see
Right.
every and everything, which we did, LGBTQIA, um, conservative Jews, Muslims. Tell me what your thoughts are about that.
I mean, what Dr. Wild just said is absolutely true. You sit there and you say, "Hey, where are these doctors?" In my case, as a Spanish speaking doctor, and being that our clinic has such a high density of Spanish speaking patients that do
Mhm.
not speak English, I always appreciate when one of the residents I get speaks Spanish. It makes life easier, and it actually creates a tremendous opportunity for you.
I remember I'm gonna interrupt you. I remember you threw me to the wolves where we had these hey, I
Me?
remember we had some residents, I believe they were residents from Spain that came to
Yes.
visit.
Yes.
And I was at the surgical center, and literally my colleagues, he was like, "You've got this. Go ahead and translate." I was like, "What?" Like these are big words. Tornillo, which is a screw. This is not like hola,
Right.
como está. But I was really thankful for that because you pushed me to be like, let me take it to the next level. Where
Right.
now, I mean, I speak it with all my patients. We have a large Latino population at Neighborhood Health, and I don't need a translator, and I can do my own consents,
Right. Yeah.
and
No,
it
you're.
makes it
Yeah.
where they feel okay. She understands me because I'm not translating through someone. I'm talking to you one on one. So
And it
thank you
makes
for
it
that.
makes a big difference to the patient. Big difference.
Absolutely.
I will tell you that in my view, as far as the opportunities available for, and not only just in podiatry, but for Black, for Spanish, for Black Hispanics, which
Mhm.
are there, the good thing now is that there are enough podiatric surgical residencies to train every podiatric student that graduates a podiatry school. And in the old days, I was always very careful to ensure the diversity, to ensure that we were, in fact, being very fair in selecting our residents. And I'm proud to say we've trained quite a bit of people from every country, every race, and it really is very interesting to see the people that have graduated the residency at St. Barnabas. But I do say to myself, what can we do? And I think Dr. Wild is right. And this actually goes along with what's happening in our profession. We do need to put the word out about how great
Mhm.
this profession is. So kids from every age, every race apply to the schools.
Absolutely. Hence the show. I'm going to ask the last
Mhm.
question, Rishi. You being African American and being female, which is a special combination, I think. I am there too. What would you say in terms of encouraging, kids who look like you, to come into the profession?
Yeah, definitely. I think a lot of it is that everybody's going to touch on is exposure.
Mhm.
I think sometimes we have, we talk to our doctors and we see our doctors, but sometimes, telling them, that's actually possible for you, and actually kind of, almost like I think, I really believe in mentorship, in terms of sometimes the doctors have to, even as we speak to them, have to tell them and have to, sometimes ask them because sometimes, that's not even discussed at home. And, a part of it is definitely exposure, and exposure from the college level, exposure from the, high school level. And, for them to know, because I know even from myself, sadly, I went to an HBCU, which really didn't know that much about podiatry, and I had to go to, a post-bac program down at Harvard. And that's really where I gained exposure. I got to shadow with a podiatrist, and I was like, oh my goodness, I love this. Where has this been? This is what I want to do. And, he did surgery, had his own practice. And I was like, this is great. I didn't even know. So I felt a lot of it is really exposure. So I do think we need to, just continually speak to the young people and say, we're here. You can come, train with us, hang with us, so that you can see what we do and see that it's very much possible.
Absolutely. Thank you for that. This was a robust conversation, and I'm just so glad to have each and every one of you on taking the time tonight to talk to us about what is podiatry, who is podiatry, where is podiatry. And what I'd like to do is to end on I'm going to give you a 30-second plug to tell us where we can find you, and one last quick fact, because we're on a time crunch, that you'd like to say. So I'm going to start with Dr. Kotzius. Tell us where we can find you for people who would like to see you in your practice, and one quick little thing that you'd like to say, a quick blurb.
Like where they could physically find us?
Yes, where can they find your practice?
My practice is in Elizabeth, New Jersey. You kind of caught me off guard on that question.
Okay, what's the name of your practice?
Elizabeth Foot and Ankle.
Okay, so we can find you in Elizabeth, New Jersey at Elizabeth Foot and Ankle, correct. And also that you are the director at Trinitas Hospital.
Correct, yes.
Thank you. Dr. Ahmed, where can we find you? And if you have a blurb that you'd like to say.
I practice in Westfield, New Jersey. The practice is called Ankle and Foot Doctors of New Jersey. You can follow me on Instagram, although I'm not very active in it, at a doctor, that's dr.amir.ahmed. And a little blurb about myself. I love kids.
Awesome. Thank you. Dr. Rishi Kowart, where can we find you, and a blurb?
Yes, so I currently am at the Westchester Institute of Human Development. It's in Valhalla, New York, so where we treat specialized patients there. And the blurb is I love to take dance lessons.
Okay. Dr. Goez, a quick blurb because we're running out of time. I'm trying to get everybody in.
I work a private office, Long Island Foot Care in Long Island, New York, and I'm at St. Barnabas Hospital in the Bronx, where we run a tremendous, gigantic service serving all the needs of the people.
Thank you. And Dr. I'm so sorry.
Mm-hmm. No. And the only other thing is that I promote podiatry in the association, and we need to all do that.
Yeah. Absolutely.
Yeah.
Dr. Lowell Wild Jr.
Well, thank you for having me today. I practice in the Chicagoland area at the Wild Foot and Ankle Institute. Nationally, I'm a part of an organization, Balance Health, that is coast to coast. You can find me on Instagram at Wild for Feet. Actually, that's and then LinkedIn at Lowell Wild Jr. DPM MBA. For those of you who are listening, podiatry is an amazing profession. We are able to help people get better when they walk in and they walk out. And it's something that I think you can see from the people here tonight. We're so proud to be a part of podiatry. And so if you have any interest in being in the profession, come join us. And if you have people who need our care, we would love to serve them.
And I'm Dr. Cordai Decoto, known as Dr. D. My umbrella is Talks for Dr. D, which you can find me all over social media. And this was Stepping Forward for Dr. D, episode 3. And we look forward to seeing you next month, the first Wednesday at 7 p.m. Thank you for joining us, and good night.
Thank you.